Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Necrotizing Fascitis. So here, the necrotizing fasciitis is a rapidly progressive bacterial infection. It's a progressive bacterial infection, and it is characterized by the necrosis of the skin, subcutaneous tissue, as well as the fascia and the sparing the underlying muscle. So it spares the underlying muscle. Next is it commonly affects the lower limb, that is a Fournier's gangrene involving the perineum. So there is a Fournier's gangrene. So it is nothing but the Fournier's gangrene involving the perineum. Next is the polymicrobial infection. The polymicrobial infection, this involves the both aerobes and anaerobes. So aerobes as well as the anaerobes. And there is a group A, beta hemolytic streptococci. So there is a group A, hemolytic streptococci. So this is the most common organism. So what are the risk factors of the necrotizing fasciitis? So the risk factors, it includes the diabetes, the immunocompromised state, the penetrating trauma, the skin infection, as well as the IV drug abuse and the pressure source. Now, what are the clinical features of this necrotizing fasciitis? The clinical feature is that it can include the severe pain. There is erythematous. There can be edema, so it is edematous. A wound with a woody hard texture, so there's a woody hard texture. Next is systemic features. It includes the fever, septic shock, so as shock. Then comes tachycardia, hypotension, and this ultimately it can progress to the DIC, disseminated intravascular coagulation, as well as the multi-organ failure. So how do you manage this condition? So management here will be by, it involves the urgent surgical debridement, as well as administering IV fluids, the antibiotics, as well as the supportive care. So there is also the hyperbaric oxygen therapy. So this can aid in case of the wound healing. So what are the complications in case of the necrotizing fasciitis? So complication is, there includes the multi-organ failure, then comes the septic shock, the loss of extremity, the severe scarring, the toxic shock, as well as it can ultimately lead to the death. To learn and grow daily like this, please do subscribe.